I don't know. I have mixed feelings today. I have real mixed feelings.
Yeah.
And I'm going to share. It's a special day. I don't know. I have mixed feelings today. Yep. I do. Good evening, everyone.
Good evening, Dr. O.
I don't think I got the right skin. I think I got it now. Welcome to Medical Mondays with Dr. O. Whew. You know, I got it was a video clip yesterday from one of our doctors in the UK, Dr. Ajayi, who is a regular on Medical Mondays, and he had spoken here before. He sent me this clip reminding us that yesterday was Depression Prevention Day. I didn't even know we had something like that. And today is 9/11. I was like, wow, what knowledge. There's so much to talk about. And then yesterday, before I got this clip, something huge happened. I can't help it but to share this little bit of it. So I talked about it because I'm looking to see next week. Next week is going to be big. It's going to be personal, if I can pull it off, for us to talk about what happened yesterday, what yesterday is about, what today is about. Because 9/11 happened in 2001, but people are still hurting. Things are still going on. And I think it's something we need to address. Mental health is huge, and especially in our communities. So stay tuned for next week. It's going to be a special Medical Mondays. But for tonight, let me introduce myself. I'm Toyin Okwesomi, a family practitioner, HIV specialist, and I treat addictions in Maryland. I am excited to be here for another Medical Mondays with Dr. O. And I could not help but bring Dr. Ajagbe back again. Remember, he told us all these topics he had, and he had to put it on Medical Mondays to remind us that he has all these topics. And I think he did that so that if you don't see him, you will know that it was me that blocked him. And I wasn't going to do that. So I pounced it on him to come back again, to come share wisdom and knowledge with us. Dr. Ajagbe, thank you so much for always imparting into us, for always willing to come share knowledge and to help us prevent the obvious and the not so obvious. Thank you. Welcome, sir.
Thank you, Dr. O. And good evening, ladies and gentlemen. It's with great excitement and mixed feeling that I come to you also today. 5 years ago, my mom passed on to glory on 9/11 at exactly 11 a.m. And so today is a remembrance of her passing. So for me, it's been a very quiet day, and thank you for letting me share the evening with you. And this topic I'm about to talk on tonight, it's a little bit complex. That most people don't see the interconnection. Most clinicians treat them as individual entities or conditions. But I want to try tonight to help us see the interconnection between these four conditions that may seem to an undiscerning observer as independent of each other. The conditions that we're going to be talking about tonight are mouth breathing, obstructive sleep apnea, or OSA. Some people will just call it OSA. Gastrointestinal reflux disease called GERD. They will simply just refer to it as reflux, as well as the fourth condition called bruxism. Bruxism is just a big word to mean clenching or grinding the teeth. So we're going to attack it in as simple form as possible. And I just want you to try to follow the way I'm presenting it, because it's a complex situation, but I try to simplify them. So what I'm going to try to do is to pair them up, and then in the end, we'll see how they are all connected. I'll pair them up separately as two entities, and then in the end, I'll summarize and see them all put together. So let's look at mouth breathing and OSA. The first thing is to define what is mouth breathing. Mouth breathing, is a situation whereby an individual breathes through the mouth because the nose, the nasal passageway is blocked. This can be caused because of allergies, trauma, or developmental abnormality, which is usually caused by deviation of the midline, which is called nasal septum in the case of the nose. If there is a deviation of the nasal septum, it can cause partial blockage or complete blockage of one nostril, thereby creating what is called upper airway restriction syndrome. And so when anybody has this kind of condition where the nasal passageway is blocked, the individual just by default opens the mouth to breathe. And so this becomes a habit for that individual until the blockage in the upper airway is restored. If the blockage is removed and the individual is able to breathe through the nose, then the mouth breathing can be stopped over time by retraining the individual to tape the mouth, or just to learn to keep the lips sealed so that it can breathe through the nose. So mouth breathing is a real big issue, and I'm sure you probably have seen individuals with mouth breathing. Now, even if you haven't seen anybody with mouth breathing before, if you ever had cold, that is, you had a situation where your nostrils are blocked. If both of them are blocked, you don't have a choice. You have to breathe through your mouth. But in most cases, it's one nostril that will be blocked. And if you are sleeping at night, you turn over, and then the nostril that was blocked will become opened. And then every time you change sides, the nostril will switch blockage, and then you can at least partially breathe through the nose. What we're trying to avoid is a situation where the nostrils are completely blocked so that the mouth would not be used as the default source of breathing. When an individual breathes through the mouth, there is a specific type of posture that the mouth will attain in order for the breathing to take place. Now, when somebody breathes through the mouth, the air is not prepared to the best, in the best way to go into the lungs. Normally, when we breathe through the nostril is specifically designed to help prepare the air to go into the lungs without any complications. But once this is bypassed, it means the air going through the mouth is not prepared to go to the lungs in a proper way. So what are the benefits of breathing through the nose? Every one of us must choose to breathe through the nose unless it's absolutely impossible. To breathe through the nose means we allow the air to, when we inhale, when we breathe in, we allow the air to go through our nostrils. As the air is going through our nostrils, whether you observe it or not, it's going on anyway. The air that we breathe in is filtered by the fine hairs that is in our nostril. we have those fine hairs to make sure that any particle that is going into the respiratory tract will be filtered off before it gets to where it will be moistened or humidified. So when it gets to where it is going to be humidified, the air will be humidified. At the same time, the air will be warmed up. One important factor that needs to be added to this mixture is the nitric oxide. Nitric oxide is produced in the maxillary sinuses. For those who may not know what maxillary means, it means the upper jaw. The upper jaw has two sinuses, one on either side of the nose. And so the nitric oxide is a gas that mixes with the air that goes into the lungs. Now, this is very, very important because the nitric oxide serves two purposes. It disinfects the air. If there's any contamination in the air, the nitric oxide would decontaminate the air. The second thing that the nitric oxide does is actually helps to open up the fine blood vessels in the lungs to allow for the gaseous exchange. That is oxygen going across this membrane into the blood vessels and carbon dioxide coming out into the lungs so we can breathe out. So mouth breathing will preclude all of this. Nonetheless, we still get some air into our lungs if we're breathing through the mouth. However, the air is not prepared, like I just said, and the air may be contaminated. And in most cases, patients who are mouth breathers often have lower respiratory tract conditions as well, either pneumonia, asthma, and other, restrictive lung conditions. Now, what are some of the things that we find in the mouth, when somebody is a mouth breather? Most of the time they present with dry mouth. When they come to a clinic or they go to the doctor's office and they are talking, their mouth, their tongue is often coated and their mouth is dry. Sometimes they have cracked lips or chapped lips, and swallowing is always very difficult because the throat is dry. Now, we're going to see the significance of this observation later on when we consider what's going on with the three other conditions that we highlighted. So mouth breathing and OSA. OSA, as I said earlier on, is obstructive sleep apnea. So when we have, when somebody has mouth breathing as a major condition, the throat is often dried. The person that has mouth breathing is unable to swallow properly. So they have an abnormal form of swallowing, which makes both the airway and the esophagus to become very vulnerable to acid reflux. Acid reflux, usually will happen because the saliva that normally neutralizes the gastric or the stomach acid is absent or reduced because of the dryness of the mouth. And this causes the lower esophageal sphincter to become weakened. And so by default, acid comes back into the throat and the patient can actually regurgitate, in their mouth and then have other side effects of acid in the mouth. So we must make every opportunity to make the mouth not to be the primary source of breathing. With the mouth breathing, we also have the propensity for the irritation of the lymphoid tissue. The main lymphoid tissues of the pharynx are the tonsils on either side of the throat, the adenoids that is in the midline in the back of the throat. And when the dry air, the air that is not prepared through the nose passes over these tissues, those tissues become irritated. When they become irritated, they become inflamed. When they become inflamed, they become swollen, and the swelling of these tissues obstructs the airway. Now, imagine somebody who is a mouth breather who has inflamed adenoids and inflamed tonsils, which are swollen, partially closing the airway. Now the tongue contributes its own when the patient is sleeping. When the patient is sleeping and they go into a deep sleep, the muscles of the tongue becomes basically paralyzed. And the default is for the muscles is for the tongue to fall backwards and actually occlude, that is, close the airway, causing the individual to stop breathing temporarily. OSA is a condition in which case, because the airway is partially or completely obstructed during sleep, there is interruption in breathing. So imagine somebody who is sleeping for 8 hours and who stops breathing at least 10 times per hour. When that individual wakes up, they must have woken up they might have been aroused without being woken up completely, at least 80 times through the night. And that's a lot of time. If each time the person stops breathing, they stop breathing for about 10 seconds, multiply 10 seconds by 80 times, and then that's the amount of time that they stop getting enough oxygen to their body. And once there's, we call the oxygen saturation is very important. And that is the reason why mouth breathing is not very helpful in anyone who already has the pre-existing condition of obstructive sleep apnea. So it's like a vicious cycle. Which one starts it? Nasal blockage, mouth breathing leads to obstructive sleep apnea, or at least makes sleep apnea worse. Now let's look at mouth breathing and reflux. Now, when somebody is breathing through the mouth, as we said earlier on, the mouth is often dry. The mouth is not as lubricated as it should be. The saliva that's supposed to be swallowed intermittently, is not available to be swallowed because the mouth is perpetually dried. Now, what happens is the lower esophageal sphincter, which is the opening between the esophagus and the stomach, becomes very weak. And automatically the acid within the stomach can flow back upwards towards the throat. And that causes the irritation of the esophagus, as well as, for those who already have a condition that is referred to as GERD before, it will make it worse. So mouth breathing and reflux, they go hand in hand. Most of the time, they're not recognized as being, partners in crime. Now, we're going to see also how the mouth breathing can actually negatively impact, obstructive sleep apnea. All right, so let's look at mouth breathing and bruxism. So we've seen mouth breathing by itself. We've seen mouth breathing with OSA. We've seen mouth breathing with gastric reflux. Now we're going to see what happens in the case of clenching. Well, the connection between the mouth breathing and bruxism, that is the grinding or clenching of teeth, is still under investigation. However, there is a major observation that has been seen. I'm not sure if everybody understands the issue of sympathetic nervous system. We've talked about it in the past, that sympathetic nervous system is the nervous system that pretty much like a reflex that affects every part of our body when we are under, a stressful condition. Now, every time somebody breathes through the mouth and there is obstructive sleep apnea, the tendency is for that individual to experience repeatedly during the night the condition, the situation that we refer to as sympathetic drive. Sympathetic drive occurs every time that the person stops breathing. There is what is called negative pressure. The negative pressure in the upper respiratory tract will cause a vacuum to be created on the other side of the blockage. That causes the gastric acid to come up through the esophagus. And at the same time, the individual will experience the fright, flight, or fight experience because of the transient release of cortisol. And that also causes the spike in the blood pressure. So for somebody who stops breathing 80 times per night of 8 hours of sleep, that means that individual has experienced spikes in their blood pressure 80 times. So that individual is not resting. It does not matter how long they stay in bed. They will not wake up restful in the morning. And also, it's been observed that the individual that experiences this kind of sleep pattern will not be rested during the day either. Because of course, they were not fully rested in the night. When they wake up, they are very disturbed. Many of them wake up with headaches. They wake up with jaw pain. They wake up with anxiety because they knew they didn't sleep well. They would not feel refreshed in the morning, and they become very short-tempered. Most of these people are the ones that cannot do anything without coffee. First thing in the morning, they must get a very strong brew of coffee, because if they don't, they're going to end up having excessive daytime sleepiness. So this is kind of like a cascade. You can see how it starts. Nasal blockage leads to mouth breathing. Mouth breathing leads to reflux. Reflux and causes irritation of the throat, inflammation of the adenoids and tonsils, closure of this airway, causing the obstructive sleep apnea. So you can see how they are all connected, from upper airway restriction to mouth breathing leading to gastric reflux leading to obstructive sleep apnea. Now, most people wouldn't want to see this as being the linear connection, but it's been proven now through series of research studies that are ongoing. So anyone who has nasal blockage continuously, who is not able to breathe through the nose, should be investigated, or at least watched for mouth breathing, for reflux, and for sleep apnea. And so whichever way we look at it, whichever one presents first, we must always try to connect the dots. But for me, it's always very clear when somebody continuously has nasal blockage, the long-term side effects of that, or long-term negative effect of that, will be obstructive sleep apnea and will lead to other conditions, particularly high blood pressure. And so at this point, for anyone who is experiencing any of these conditions, they need to seek help, because they will not go away by themselves. And taking antacid for reflux without figuring out what the underlying causes are will not help the situation. And we know long-term acid reflux can cause a whole lot of damage, not just to the esophagus, but even to the mouth itself. When somebody constantly regurgitates, for instance, due to acid reflux, their teeth will be dissolved from the acid over time. So many people, they look at their teeth, they say, my teeth has been have been discolored. What is going on with my teeth? I want to bleach my teeth. Well, many of them, if they knew that they've been having reflux, they need to check it out. The acid reflux may actually be doing more damage to their teeth and also causing them to wear down their teeth more from the grinding. Now, grinding comes with intermittent, oxygen deprivation to the brain. So every time somebody stops breathing because of OSA, the body kicks into the sympathetic drive, which we talked about earlier on. And one of the ways by which some patients actually manifest this is in clenching their jaws, because the body wants to open the airway. And the only way to do that is to slide the jaw, the lower jaw forward, so that the tongue that is falling backwards, blocking the airway, can be moved. For most people, this is like a reflex, and they don't even know they are doing it. So that many times we tell people, when we see their teeth worn down in the dental office, we tell them, have you been grinding your teeth? Do you know that you've been grinding your teeth? They say, no, I've never been grinding my teeth. Nobody ever told me that I've been grinding my teeth. But usually I will show them in their mouth how it's very obvious that their teeth have been filing each other as they grind their teeth over time. And so they get convinced by that, and they start catching themselves that they're actually clenching and grinding. Now, many times, if they don't even know that, they don't agree that they've been grinding, they will at least admit to some things. They may admit to the fact that they are having headaches that they can't even explain, or they have jaw pain when they wake up. They have muscle aches in their jaws. The muscles that they use for chewing are constantly hurting them. So these are signs of, clenching and grinding of the teeth. So at this point, I'm not sure, if I'm able to, I've been able to explain this in a simple term for everybody to understand. But I think during the time of question and answers, we might be able to, explain a little bit more. But I try to make it as simple as I can make it. But hopefully I've been able to accomplish that. Thank you for your attention. We will engage in some questions if you have other things to clarify. Thank you.
Thank you so much. Oh my gosh. You put all those big words into simple language. Thank you. And you connected them very nicely. Nasal blockage, I put something in the chat box for anyone interested. Nasal blockage, mouth breathing, reflux, obstructive sleep apnea. Thank you so much, Dr. Ajagbe. These are things that we take for granted that I'm sure most of us on this platform have not connected. And you mentioned it, that obstructive sleep apnea, causes high blood pressure, if not treated. I added daytime sleepiness that can even cause accidents on the road when somebody is sleepy and, sleep on the steering wheel. We've seen it happen. It can cause diabetes, and the list goes on. And then reflux. Oh my goodness. We just say reflux. It can cause this thing called Barrett's esophagus, because the structure in that where the esophagus joins the stomach changes and then eventually cause cancer.
Yes.
Reflux.
Mm-hmm.
So just to buttress what you have said, I know you purposely held those out because you don't want to overwhelm us, but I feel like you spoke simple enough English that I think we wouldn't be overwhelmed. So take it a little bit further, that there is more. These things are not to be taken for granted. But now, Dr. Ajagbe, I just want to ask this. Prevention in all of this, we see the connection, we see what happens, and we see that horrible big things can happen if nothing is done to prevent, like nasal blockage, the mouth breathing, reflux, and all of that. What can we do to prevent? I mean, what causes the nasal blockage?
Okay.
With?
All right. Thank you
What
very
are the
much.
causes of reflux?
Yeah. So
thank you.
Thank you very much for the question. Well, what I've tried to do was to try to trim off a whole lot of things that might create more confusion. So yes, how can we prevent this? Anything that causes nasal obstruction, whether it is allergy or it is infection or it is nasal polyp or anything whatsoever, or just deviated nasal septum, anything that will cause the nose to be blocked needs to be evaluated and managed. Some people will say, oh, it's it's a habit. I just don't know how to breathe through my nose. Well, people can actually be trained on how to breathe through their noses. That's what we call the buteyko phenomenon, buteyko breathing exercise, that people can learn on how to do that. For instance, if let's say you came back home from work, or maybe you're at work or anywhere, and all of a sudden you start feeling one nostril being blocked. And all of a sudden it looks like both nostrils are getting blocked. Well, you can actually open up without taking any medication at the same time without, being alarmed. Now, I want everybody to try this. As you're watching me, breathe in, hold your nose tight without breathing out, okay? Listen first before you do it. So, I'll demonstrate it, then you can see what I'm doing, okay? So I want you to breathe in. When you breathe in, hold it and pinch your nose tight, all right? And what you're going to do is you're going to nod 5 times and let go of your breathing. I mean, the nose that you pinch and breathing. And you do that continuously until your nasal blockage is open. And I assure you, you will not need any medication to open your nostrils. If you try that when your nostrils are blocked, you will not take any medication to open the nostrils. And every one of us should be able to breathe. The normal breathing is quiet, invisible breathing. Can everybody repeat that to me? Quiet, invisible breathing is the normal breathing.
Quiet, invisible breathing.
Yes. If you don't have quiet, invisible breathing, then you are laboring while breathing, and that means there's a problem. And the problem is partial blockage somewhere. Now, if it's not in the nostrils, it's in the back of the throat. If it's not in the back of the throat, it's in the chest. So anytime there's a partial or complete blockage to the airflow, you will experience the negative effect, which we call the sympathetic drive. So that's the prevention. Prevention is just to make sure that the nostrils are not blocked. If the nostrils are not blocked, there'll be no need for you to breathe through your mouth. If you don't breathe through your mouth, there'll be no reason for acid reflux to take place, unless there are other conditions, presenting as acid reflux. That if you don't have mouth breathing and you don't have nasal blockage, there is no way you will have acid reflux, unless there's a problem in the stomach itself. Now, I don't know if that addresses the question, how to prevent it. Everything that you must do.
Before you go on, sir, I'm being asked over and over that you should please repeat how to do that.
Okay, so the process.
Yes, thank you.
Okay, to open your nostril is very simple if you have nasal blockage. You breathe in. So watch me, I'm breathing in now. And then I pinch my nose. When I nodded the 5th time, I let go and breathe out. So now I can breathe back in. Now, you can do the reverse as well. You can breathe out. Let's say you breathe in a lot, you say, and breathe out deeply. Don't breathe through your mouth, breathe through your nose as much as possible unless your nostrils are blocked. If your nostrils are blocked, you can breathe through and breathe out through your mouth. When you breathe out as much as you can, then pinch your nose and nod 5 times and let go and breathe in. Your nostrils will open over time. If it doesn't open the first time that you nodded 5 times, it will open the second time. If it doesn't, continue doing it until it opens. And so you will at least avoid all the spraying of your nostrils and causing more irritation and rebound effect of the medication, because once the effect wears off, then your nose gets really blocked now because you've been irritating your nostrils with the chemicals. The inflammatory process will actually become compounded without you knowing. And that's why the manufacturer says, well, you use this specific number of times during the day, so that every time you use it, you think you want to use more, because your nasal lining, the lining of your nasal cavity is already irritated. Now it's being irritated more with the chemicals you are spraying in it. So prevention is just make sure you do not get blocked nose.
You said prevention is make sure we don't get blocked nose.
Mm-hmm.
I'm sorry to ask this question. What are the causes of blocked nose to start off with? You've told us how to unblock the blocked nose.
Okay. What I've said before is there could be developmental reasons why the nose is blocked, right? For somebody who has a deviated nasal septum, that is the plate of cartilage and bone that separates the left from the right nostril is the septum. So sometimes you see somebody with a crooked nose, in which case the midline is shifted to one side. If that is the case, there is partial blockage. If nothing is going on that blocks the second nostril, the individual will still be able to breathe, but it will still be labored breathing. Okay. If somebody has been having allergies for years and they're constantly sneezing, they're constantly, irritated and being blocked, they use all kinds of medications, both systemic as well as topical, that is the one they're spraying. And instead of improving the nose, the lining of the nose becomes, chronically thickened. When that is thickened, most of the time you have to see the ENT surgeon. The ENT surgeon will do something, either cauterizing it or trying to do something to keep the place as open as possible. So in that case, it has to be there has to be an intervention from a specialist. Sometimes there is what we call polyp, nasal polyp. The nasal polyp is an overgrowth of redundant tissue that actually may come from the sinus and extends right into the nose and blocks the airway. Sometimes when somebody has that, they will think they have mucus there because it vibrates just like mucus. It's gelatinous just like mucus, except that you cannot blow it out. That is a polyp. That one has to be cut out by an ENT surgeon. You have to go see the specialist. They will diagnose it, they will take it out, and the person's nostrils will be open. There may be other things. There may be, a fracture in case somebody who is involved in a road traffic accident, the nasal, the facial bone is fractured in what we call the Lefort fracture. That may create a temporary blockage of the nostrils, which will now be opened up through surgery, and the patient will be able to breathe properly through their nostrils again. If there is a tumor, there are tumors that can actually grow from the base of the skull that grows right in the midline, and they can block the airway. There could be tumor or salivary gland tumors in the back of the throat that can be big enough that can actually close the airway. If there is inflammation of the adenoids and the tonsils, that is not related to mouth breathing, well, that has to be treated by an ENT surgeon as well. And once that is taken out of the way, the airway will become open again. So I'm not sure whether that's enough conditions to prevent the nasal blockage.
Thank you so much, sir. Yes. How about reflux? What are the causes of reflux? How can we prevent reflux? A lot of people have that.
Okay. Most of the time, like I said, most people don't see the connection between these 4 conditions. So let's say somebody always snores, for instance. Say, oh yeah, it's common in my family. We snore a lot in my family. Okay, fine. You don't even know why you are snoring, but you assume that it's a normal phenomenon. Now, suppose it's not a normal phenomenon because you're already having an undiagnosed obstructive sleep apnea. For those people who have undiagnosed sleep apnea, they will be experiencing reflux and they will never tie it together because they will be thinking, oh, it's the kind of food I ate. Every time I ate pizza, every time I ate this that has that and has the other is the reason why I have, heartburn, and heartburn is usually been connected to reflux and so on and so forth. So the primary causes of reflux can be local to the GI tract. For instance, somebody who eats, I think I shared it during the last presentation that, the guest speaker was speaking. I can say that if you are constantly drinking cold water or cold drinks when you are eating food that is rich in fat, you will have reflux because the oil floats on the top, particularly, if you're drinking cold water, any oil in your food becomes congealed. And that, if you put fat in water, it will float. It doesn't matter what kind of fat, whether it is from goat or cow or from chicken, if you put fat in water, it will float. So that automatically will go with whatever is mixing in the GI tract towards the throat. So most people that have regurgitation, for instance, they always have most of the lipid, the fatty part of their food first in their mouth. Another thing is if you are eating baked goods, particularly bread, and you are drinking a lot of things. For instance, you're drinking tea with it, if you're drinking tea, it's still okay because it doesn't, the tea actually stimulates peristalsis. That is the contraction of the stomach in the direction that the food should move. Every time that you have retrograde peristalsis, which is a big word to say your food is coming back up, instead of going in one direction, let's say it's going towards it's supposed to go towards the right side, but it's coming back towards the left and it's flowing back upwards. That is retrograde peristalsis, and that will cause you to either, not only would you have reflux, you also have nausea. every time you have nausea, that's because your peristalsis is moving in the opposite direction. And in most cases, they will end up having to throw up, or they will, force themselves to throw up in order for them to feel relieved. And that often goes with gas. Also, when you chew a lot of chewing gum, for instance, some people chew gum all day long because they want to have good breath. They don't want to have bad breath anytime. So they chew gum all day long. Well, when you chew gum all day long, what you're doing is you're swallowing a lot of aerated saliva. Saliva that you are swallowing is very bubbly, is very, has a lot of, air mixed with that. And when that gets into the stomach, the gas has to escape. Somehow, somewhere, if it doesn't go in the direction of normal peristalsis, you will have to be burping all the time. So some people will talk about, being, like they are bloated, they have a lot of gas in the stomach that they need to, most of the time, or a lot of the times, when you burp, and you burp with the kind of acid concentration in your stomach, you may actually feel a little bit of your food coming up with a burp. So these are things that causes the reflux other than from, sleep apnea. So if anything is going on in the stomach, or the sphincter itself is already weakened, or there is what we call hiatus hernia, that is the stomach comes through the opening, there's the opening in the diaphragm where the esophagus penetrates to go into the stomach. If there's a weakness in that opening, a little bit of the stomach can come out up towards inside the chest. And that is a hiatus hernia. And that necessarily will also come up with reflux.
Wow. Thank you so much, sir. I just want to encourage everyone on the platform that we need to work also on our abdominal girth. Is there something you want to say about that? The abdomen, when it comes to reflux. I see the connection in this, but, reflux is something that is, quite scary because of that possibility of developing cancer eventually. And the purpose of this forum is that we prevent.
Mm-hmm.
So that, we don't have to deal with horrible disease entities. So, Dr. Ajagbe, I think you killed it tonight. You did an excellent job that people don't have questions because you made it so clear.
Okay.
And that's what I see. That you made it very, very clear. It was, if you have any questions, please raise your hand or, put it in the chat box. I'll ask it. There's a question here. It says, at times, she says that she eats foods and after she starts to sneeze and then her sinuses block up. So she eats, then she starts sneezing and then her sinuses block up. But it's temporary. She's asking if there are certain foods prone to block sinus airways and trigger this.
Okay, I can speak from personal experience. I can tell you, if you are allergic to any food and you don't even know it, it will present itself in many ways. One of them will be sneezing. First of all, your nose will start running before you start sneezing. And then you start sneezing and eventually the nose will be blocked. What most people call sinus blockage is not necessarily sinus blockage. There are some bones in the side walls of the nose that are called conchas or turbinates. Those turbinates, they are kind of like they are ridges through which the air going in can be slowed down. So when we are breathing in, the air can be slowed down so it doesn't gain too much speed, more than, like if somebody is riding the motorbike, for instance, for air to go in slowly with not at the same speed at which the motorcycle is going, is probably one of the reasons why the conchas are in place. Now, when those conchas, the covering of those conchas, which are bones, the conchas themselves are bony structures from the side of the nose, inside. Now, the covering of that is the lining of the nose. It's the same lining of the nose, and this can become very thickened. Now, the biggest turbinate, which is at the bottom, is actually covering the opening where the sinus is, the opening of the sinus is. And usually when there's any irritation that goes into the sinus before coming back out, it can cause irritation in the sinus. But primarily, most of the things being described as sinus problem is not necessarily sinus problem, unless when you look on the X-ray, you can see like a fluid level, which means there's a fluid accumulation in the sinus. And most of the time, it's because there is an infection inside the sinus itself. So the nasal blockage that is coming from food allergy will be limited to the nose. And if you take anything like any anti-allergy medication, it should relieve you temporarily until the allergens are taken out of your system, and then you repeat it again. Maybe let's say it's a food that you really liked. For instance, I loved shrimps, shrimp and tomato. I love shrimp and shrimp cocktail. And later on, I discovered that I'm allergic to both. I'm allergic to both shrimp as well as the tomatoes in the shrimp cocktail sauce, the cocktail sauce. So I will eat this, and immediately I finish eating this, I'll start complaining that I can't breathe. I mean, my respiration will be shutting down. I'll feel like there's a weight on my chest, like somebody is actually choking me. Well, I didn't realize it has anything to do with the food. I will assume that it was an environmental thing. Oh, maybe somebody was smoking when I passed by, or there was a dust, or there was pollen in the air or something. I will attribute it to something like that. But most of the time when I would take any allergy medication, I may feel relieved, unless it's a very severe situation. Then, of course, I have to go and see the doctor and get treated for that. But I can assure you, if you eat something and you start sneezing, it's more likely you are allergic to something in the food, not necessarily the whole food. It may just be the spices that is in the food. It may be just one item that you are allergic to. Until you've done a panel allergy test, you will not be able to rule out which one it is. So you can consult with your primary care physician to ask for allergy test, not the skin patch allergy test, but the real. I think Dr. O can talk more about the allergy test. I took that test, and that's where my epiphany came up, my eureka moment about, wow, this is what is killing me. I'm spending my own money to kill myself. So I had to quit cold turkey. Once I knew what was killing me, it was a no-brainer. So I'm advising the person who put the question there to find out, what the allergy panel looks like. And once they know, if they can quit whatever is causing them to be sick, of course, I think that's their prerogative. Thank you.
Thank you. Well, thank God for Dr. Ajagbe's life. When I met Dr. Ajagbe could not breathe. And I praise God for how far we have come.
Thank you so much. Thank you.
When I told him, Dr. Ajagbe, we got to fix this, he was looking at me that I've seen many doctors. I've taken many medications. I said, no, come to my office. The Lord's going to do this. And the Lord did it. Yes, allergies, food allergens can be deadly, you know. So thank God. I won't say that more than that. So
yep, absolutely. I'm a living testimony to that.
yes. You know, when I did this allergy panels, I said, this is what is killing you. I mean, it's mind-boggling. It was like, what? And I said, look, solution. Dr. Ajagbe did not take the solution. And he decided to just conform to remove every allergen from his food. And I respect that. I respect that. And he's been able to, you know, eradicate that kind of lifestyle where one would eat and not be able to breathe. So there's a question here, Dr. Ajagbe. Do these conditions you discussed have any connection to COPD?
Well, COPD
or ARDS, sorry, COPD or ARDS. He added that.
All right. So anything that is affecting the airway and is chronic eventually will cause respiratory failure. That's usually the long-term outcome, and which is not a very positive outcome, by the way. So the things I've discussed, they primarily seem to be related to upper airway restriction syndrome. But if it goes beyond, the larynx and it goes all the way down through the bronchioles, through the trachea to the bronchi to bronchioles and all the different fine branches, and eventually the lungs is no longer efficient in its functioning. Then, of course, if there's a mass or there is a blockage, which is the reason why it is called COPD, chronic obstructive disease, pulmonary disease. So we have to remember, anything that cannot be controlled in time, either because it's not diagnosed early or because it's diagnosed early and not managed properly, will eventually lead to the chronic negative outcome. So I can see that if the predisposing factors are addressed early, and the individual is not a tobacco user or working in construction or places where their lungs will become attacked over time, there's no reason why they will have COPD, just because they had a nasal blockage at some point.
Thank you so much, sir. Thank you. So right on point, as usual.
I raise my hand. Can I speak, or I have to raise my hand?
Oh, go ahead. Go ahead, speak. And Chris,
Dr.
I'm
Buka.
going to call you after that. Okay? Dr. Buka chanced you. And Dr. Buka, thank you so much. I'm going to put you out there. You know that the mission trip she went to, she brought me pressed. I'm not
coconut oil. Okay.
Oh my gosh, why did you say hand-pressed coconut oil? I mean, awesome. Awesome. She brought me different types.
Doctor, save it for us on November 3rd, please.
Oh my gosh, okay. I'll remember that. I'll share, but just a little bit. Dr. Buka, it's yours. And thank you.
I was just saying, in terms of sleep apnea, in anesthesia, we have an acronym we use, which people don't have to remember, but I'll just tell you a few things that you could think of if you have obstructive sleep apnea. It's stop bang, STOPBANG. S is for snoring. Do you snore loud enough outside so somebody could hear you outside? Are you always tired the next day? Are you observed having apneic attacks? Do you have high blood pressure? what is your BMI, body mass index? Are you more than 35? And your age, age over 50, your neck circumference, I think they use, if it's inches, 16 inches. And gender, men are considered to be more likely to have OSA. So the stop bang is what?
Did you say waist or age?
Age greater than 50, neck circumference greater than 16, and gender, males more than female. So we use those criteria depending on if you're 1 or 2, 0 or 1, we come up with an assessment of sleep apnea. So I just want people to know if there's some of the points that they could look at is snoring, tiredness, apnea, high blood pressure, like we mentioned, your body mass index, how fat you are or how slim you are, your age over 50, because of course your structures get weak, your neck, some people, once you look at some people with a fat neck, a neck circumference more than 16, and your gender. That's all I have to, that's what we look for when you come for anesthesia.
Yeah, thank you. Sorry, Dr. O. Thank you, Dr. Buka. Yeah, normally we talk about the neck circumference for women being above 16 and neck circumference for men above 17. Anyone who has that neck size should at least be on the lookout. If they're not overweight, it means they have a jowl. And if they have a jowl, it means they have excess fat in their submandibular area, which definitely pushes backwards. It doesn't often come forward, it pushes backwards. So, and when it pushes backwards, it's without even sleeping, you can hear some people's breathing. Remember, I asked you to repeat after me that a healthy breathing is silent and invisible. If your breathing is not quiet or silent and it's visible that people can see you doing this when you are breathing, then you know you are not normal. Your breathing is not normal. So that's where you have to begin to notice that there's a need to seek help. And yeah, if somebody has the neck size of 16, if they are female, neck size of 17 and above, if they are male, they should be evaluated for sleep apnea.
Fantastic. Except that in anesthesia, the criteria is different. And you dentists are more tolerant with the neck size. In medicine, it's a little bit different. So we take one step down, it's 16. So Brother Chris, all the way from Nigeria, you're looking so much brighter than some of us here that it's 9 a.m. or 1:30 a.m. over there. So please ask your question.
Very good. Anyway, thank you, Dr. O, and thank you so much, Dr. Ajagbe, for the talk. One particular one caught my interest, and I believe so many laymen like me. You said, with Dr. O confirmed that, the allergy in your food was what you attacked, not to take out the food that was giving you allergy. So for me now as a layman, how did you do it? And then I want to learn from you so I can do it myself. So that, because if I'm addicted to a particular food and I don't want to let it go, even though it's giving me allergy, I should be able to remove the allergy and eat the food. So that is where I'm going.
Okay, Dr. Ajagbe, let me answer that question before you intervene. Okay, so that wasn't exactly what I said. When I tested Dr. Ajagbe, he was allergic. Think about it. We are Nigerians, or most of us on this platform are Africans. Most of us are we Black, and we eat tomatoes. Nigerians especially put tomatoes in all sorts of our sauces. vegetables, stew, everything. You know, it's tomatoes and onions that are the basis, really, of our stews. And Dr. Ajagbe is allergic to tomatoes. So he became creative. Instead of eating tomatoes, he cut off tomatoes from his food. He doesn't eat tomatoes. He uses red bell peppers for his sauces. And I tried it. It was actually tastier than having tomatoes, because I'm like, what is this man doing? And it's amazing. What he did was he stopped eating everything that was causing him trouble, but he creatively replaced them. Now, because I said it, is why I wanted to clarify it. Dr. Ajagbe, go ahead, sir.
Well, I think what he wants to say, his own question is basically what you proposed to me before. You know, when the report came, you proposed to me, well, why don't we try to address the allergy while you're still eating this food? You know what I mean? You can challenge your body little by little with the same allergens over a period of time, and eventually you can tolerate it.
Over 2 to 5 years.
So that's what he is alluding to. So maybe you can help him see how he can move from, you know, being able to tolerate being allergic to being able to tolerate the food that he's allergic to. That's what he's asking.
Yeah, it would take treatment like that. We do, you know, it's basically desensitizing you from your allergens. And it takes a while, it takes years to do that. And Dr. Ajagbe said it so accurately, is basically introducing back to you what you're allergic to, but in little quantities, and then increasing it over the years until your body now, you know, accepts it. Don't stop, you know, rejecting it, you know, just trying to speak English to say that. But, you know, the first treatment of allergy is to know what you're allergic to and removing yourself from it, period.
Absolutely, that's me. I didn't want any more trouble. I didn't want any more trouble because really, I think I just allowed the Yoruba proverb to work in my mind, because, like, you know, if you've seen somebody struck by thunder before, you wouldn't want to abuse Shango behind closed doors, because if they say Shango is the god of thunder, and you've seen somebody struck by thunder, and be like, I don't want to be bothered by thunder. So for me, once I knew my my allergens, I decided, well, why should I be struggling with this? I mean, first of all, I needed to find out, are there alternatives? If there are alternatives, well, can I survive on the alternatives? Well, one of the things that I think, you know, just for the benefit of those who might want to learn some things from this, is that food allergies, like Dr. O said, it's very deadly. I mean, you don't even know when that could happen. If food allergy is just nasal blockage and sneezing, wow, I would call that very mild. But when a food allergy gets to become severe, you know, allergy that actually affects your breathing, then that is deadly, because most of the people that have food allergies eventually have asthma, and they don't have very mild asthma. They have very severe asthma. And many people who say they have not been able to shake their asthma since they were young till they are old, is most likely that they are still exposing themselves to the allergens, most likely the food they are eating. And most of this food are the food that you say, whoa, I love this food. I can't do without this food. I mean, until you find out, well, if this food is going to kill you, would you rather die or you stay alive and find alternative? So that's what I did. I decided to find alternatives. And there is infinite number of alternatives out there. I mean, okay, think of it. I've not eaten rice for the past 17 years.
It's since 2011. Is this
2011.
2011.
2011, that's 12 years. Okay, let's say 12 years ago. So from about 12 years ago, I've not eaten rice. So do I miss rice? No, I don't miss rice. I've not eaten tomatoes since then. Have I missed any? Do I miss tomatoes? No. In fact, I loved shrimp cocktail sauce so much that, every opportunity I had to eat the cocktail sauce, I was in. Until I knew that tomato, contained tomatoes. And then, of course, I had to make a very conscious decision. Do I really want this? Or what do I really want? And so cutting off my allergens was not a big problem for me, because it was easy for me to just say, look, I know the difference. I knew the difference when I couldn't breathe. I could compare it to when once I removed the food, I was beginning to be weaned off of medication, that I don't even have any need for medication now. I don't even feel any irritation anymore, because initially, even if I just smell some of the food, I will start having irritation in my throat, but now I don't. So foregoing them was very helpful to me. So if there's anybody, I think your best bet is find out first, what food are you allergic to? And then see if you want to tolerate it, go over, with your physician on how to reintroduce it to you slowly until you can become accommodating to the food allergy.
Thank you so much, Dr. Ajagbe. There's a question here that are all foods potential allergens? Yes, they are.
Yes.
Yes, they are. Let me tell you this. I tell people all the time when they don't want to take medications because they don't know what the effect will be. I tell them, do you eat? Because you can eat anything and anytime develop allergy to it. And you don't develop allergies until you have been eating it or been exposed to it. People don't understand that it's something you've been exposed to, usually that one day what we call the mast cells will just release, and then you get the effects of the allergies, the way it would affect you. I went to visit a friend of mine. She's a physician also. She has history of asthma, and we both love mangoes. So as soon as I walked in her house, I saw these ripe, sumptuous mangoes on her table. So I grabbed one, washed it, and cut it up, and we started eating, and she joined me. And all of a sudden, she went, she couldn't breathe. Shortness of, I'm like, okay, I know what had happened. She developed allergy. And like Dr. Ajagbe said, it can kill you. If we didn't have intervention right there and then, it'll be a different story. If 911 doesn't get there on time, it's a different story. But she has history of asthma. She jumped up. She's a physician, went to her kitchen cabinet that was right there, medication cabinet, grabbed a steroid pill. No, she had a albuterol inhaler to even expand her lungs. She used the inhaler real quick, a few pumps, expanded her lungs, and then she popped a pill of prednisone, and she actually chewed it. And, in a few minutes, it calmed her. So when I saw that she was fine, I finished the mango and I took the rest of it home. I'm like, you know what? You part ways with mango today, but I gained some mangoes. But that was how it happened. So she couldn't eat mangoes anymore. Just like that. So all foods are potential allergens, and it's just important that one won't be mindful. So these symptoms, when it occurs, a lot of people, if you pay attention, you can actually figure it out yourself, unless you have extensive allergens, then you can't. But, you may be able to figure, like what happened to her It was very obvious. It happened spontaneously in the presence of, two physicians. She knew what happened, I knew what happened, but it doesn't always happen that way. So
can I add something real quick?
Yes, please, sir.
Well, for those of us from Africa, this is one of those areas that have been attributed probably to witchcraft or somebody poisoning you, your enemies, family enemies are doing this and doing that. If you have food, many people probably died in Africa from food allergies rather than being killed by poison. And I can say that again because when you say this food, I love it so much, and you say, well, I can't do without it. And then you go to visit somebody not knowing that you are allergic to that food. Or maybe they cooked it and brought it to you at home, or you cooked it yourself. And then you ate it, and then something bad happens. It is easy to start looking for scapegoats. And it was my own personal experience that made me come to this conclusion. That I'm almost very sure, I can't say I'm 100% sure, I'm almost very sure that there are a lot of cases of people that just died from eating and they thought somebody poisoned them. And they believe that, somebody actually did some kind of voodoo or juju that they put in the food that actually killed them. Please, we need to be very cognizant of what we are eating. It's not for you to be afraid. It's just like Dr. O said, be mindful. Just be watchful. How do I feel when I eat certain things? Even though I love to eat certain things, how do I feel when I eat them? And then once you know how you are feeling, then you should decide, if you want to go further, just find out more. Is this food allergy or just food aversion? If it's food allergy, then all you need to do is just do the test and then confirm it and then decide whether you're going to challenge yourself over a long period of time or you're going to quit cold turkey if you want to stay alive and well.
Thank you so much, sir. My sister Tokumbo said she discovered that she had not allergies that cause her face to break out. It doesn't cause respiratory distress, but it causes breakout. And yes, that is fact. That was why I said you will find out what that allergen causes you because it's different from one person to the other. There's another question. What about foods? Mr. Nana Kwado said, what about foods you may feel allergic to, but are undetectable through allergy profiles? Question is, are the allergy profile tests the gold standard?
Well, for what I may say is for most common food substances that have been tested, yes, there might be some more that I may be allergic to that I don't know. But since I don't get myself, challenged by the ones I know, there will be no cross, reactivity to other foods. For instance, I observed that when I've already, imagine this, I have 4 different allergens in one meal, and I didn't know. So I had rice there, I had tomato there, I had shrimp there, and I had peanuts. And of course, soy, all from Chinese food. And all 5 I'm allergic to. So I'm enjoying this. I didn't know that I'm allergic to it. If there was no test, I wouldn't know that it was allergy. All I knew was almost every time I ate Chinese food, I had a problem. And the problem is for 2 days after eating Chinese food, I'll feel like there's a lump in my throat. Now, I later discovered that it was because my body was secreting mucin, thick mucin, to try to block off the allergen from my system. But now I'm feeling the lump in my throat. Drinking water was not addressing it until I found out that rice, peanuts, shrimp, and then what else? Rice. They are all on the same, and soy sauce. They were all on the same plane with me for allergy. I decided to quit. I don't need any Chinese food. I can survive without Chinese food because everything that they served me was killing me. And I didn't know that until I found out independently of them that this was causing me a lot of grief. Then I had to decide, do I still want to be feeling this way or not? Another thing that I experienced was when I was young, as a little child, growing up in Nigeria, I hated bread. Most children love bread. As a child, I hated bread. I didn't know why, other than the fact that I knew when I ate bread, I always felt like there's a lump in my throat for 2 days after I ate bread. Everybody loved bread with moi moi, bread with akara, bread with egg. And every time I saw it, I wanted to eat it, but I knew every time I ate bread, I wasn't comfortable. Only to find out maybe 50 years afterwards that I'm allergic to wheat. So bread was made from wheat, and I didn't know I was allergic to wheat.
Dr. Ajagbe, you need to do ancestry.com. You're not a Nigerian. You can't eat rice, you can't eat bread. You must, must be from Egypt or somewhere.
So by the time I knew that I'm allergic to wheat, now in retrospect, I look back, I say, hey, so God has been trying to keep me away from this thing that could have killed me. Another thing I need to let you all know is that every day I had hives. I had skin rashes every day growing up. So I didn't know which food I was allergic to. I didn't know it has anything to do with food. All I knew was every day when I was very little, they would apply palm oil on it as antidote. They say, okay, rub palm oil on your skin, so it won't be itchy. Well, it did help. It could be a form of placebo, but at least it did help. At that time, I wasn't having itches. So if anybody suspects there's something that doesn't agree with their system, I think even without any allergy test, just let it go. Find an alternative to it, and then you will feel better. I mean, if you feel better, you can find alternative, I think you feel healthier. Because all that we are talking about is prevention to stay healthy long-term. Because if you don't prevent what can really hurt you, whether it is in terms of breathing or eating, well, those are the things that keep life going. Yeah. They keep life going because if you avoid them, anything that can harm you, because that's what we owe ourselves, we must stay away from danger.
Thank you so much, sir. Thank you. So to your question, what about foods you may feel allergic to but are undetectable through the allergy profiles? I think that question has been answered very well. I would add that you look at the foods themselves and see if it's actually a combination. That every time you eat something, you're eating it with one thing, and then separate them and see if you have reaction to the one. But when you're separating foods, you want to stay away from those foods for at least a week and then introduce one at a time. That's another way to see if you have any reaction. So Aduke said, so anytime we eat, it's playing Russian roulette. She doesn't like that. No, not really. I don't want you to have that kind of attitude to food. We're just saying that it is possible to develop allergies to foods that you have been eating before. It's a possibility. That's all we're saying. And I think the question to why did Dr. Ajagbe stop eating rice has been answered. The allergy testing that we did show that he was allergic to rice, and he just left it alone. That was why. So
Oh, sorry. No, that was just hypothetical. That was just something that I was just saying, not that I took it literally. I'm just saying anything is like playing Russian roulette. So nothing, what he did a very good explanation on, and I'm going to take that allergy panel test.
Good.
Thank you.
Thank you. Thank you. Please do. It's life-saving. It can be life-saving. So,
Doctor, can I add one more thing? You know, every time you go to the grocery stores, every time you pick up processed food, whether it is in the can, bottle, box, or whatever, anything that is packaged from a factory or an industry, please check the label. I never used to do that until I got my allergy test results. And when I found out, what I found out was there were hidden allergens in almost every packaged food. Every packaged food had a hidden allergy because they use so many things just to keep the food longer on the shelf in the stores. So if you are not very careful, if you don't check the labels, I'm sorry. Just the question, the one before the last, the one that's saying, suppose you don't even know the food that you're allergic to, or if the food that you're allergic to doesn't show up in the allergy panel. I'm almost sure that many of the things that we know, but we don't check for them when we go to the grocery stores. We just pick them. Oh, I like this brand. So it's like, okay, I like Heinz. Okay, every time you see Heinz, you don't even check anything anymore. Say, oh, it's Heinz, it's good quality. What you need to check is does it have high fructose corn syrup? If it has high fructose corn syrup, what is high fructose corn syrup doing to you? Is this something you really want to be exposed to? Even though it may not be obvious allergies, it may become something that is problematic later on. Any food, and I'm almost sure, I don't want to put statistics, but I can tell you a lot of the food, processed food, has high fructose corn syrup.
thank
And
you.
high fructose
And it
syrup
causes
has
diabetes.
allergy. Has caused some people allergies, and there are documented cases of allergy to high fructose corn syrup. So in case you're eating something that has high fructose corn syrup and you don't even see it as a potential for allergy, well, just observe it. How do you feel when you eat stuff that has high fructose corn syrup? And there are other things,
And that goes
dyes.
for everything else. It
Yes.
does. Really.
Dyes and
Oh.
everything they use to preserve the food or to make it look beautiful, all of those have shown up to become allergens at some point to some people.
So we need to be reading the ingredients.
Mm.
Nana Kwadwo, Mr. Nana Kwadwo said he knows somebody who thought she was allergic to seafood, shrimps, but allergy test came out negative. This is the basis for the earlier question. Yes, allergy tests may come out negative, but what are the seasonings that are put in the seafood that she eats, in the shrimps that she eats? So that may be the thing. That's what we're saying. When there are combination of things, you got to tweak them out. So our allergy may not be shrimp itself because the allergy panel doesn't show it, but it could be, is it the black pepper or is it the kind of tomato shrimp sauce that Dr. Ajagbe loves so much that she enjoys with her shrimp. So the shrimp itself may not be the problem, but the sauce that she uses to eat it. So that needs to be tweaked out. Sister Tokumbo said, thank you, Dr. Ajagbe, for your point about household enemies, that she said she does not visit her older brother because he has dogs and she has pet dander allergies. It took several years of her rejecting his invitation to visit him and explaining her allergies before he got it right. So he has finally accepted and doesn't bother to invite her to his flat anymore. And she also said she actually had to show him her Flonase inhaler before he believed that she had allergies, and not that she suspected him of dark plans. You know, I know this is my sis. I know her very well. Thank God. It is true. This is our culture. But I know her. She's the sweetest person, but assertive, and would help you to understand the truth. Thank you for sharing that, because it's reality. So Sister Aduke said, Dr. O, okay. She said, in a culture as a youngster, her mother would tell her some food don't go with her body spiritually. So back in the days, she would see a spiritual nutritionist. She would see a spiritual nutritionist. For example, okra, but she loves it. It's ingrained now. She's asking if you believe there is some medical scientific explanation to this superstition. So and to buttress what she said, my mother-in-law used to tell me I'm something because I eat okra, that I shouldn't eat okra. It's not something you should eat, and some basis. So she's asking if there is scientific explanation to this superstition. Thank you for calling it superstition, because it is. Go ahead.
Well, I mean, there are so many things we don't know. And we shouldn't presume on everything being diabolical if we can't explain it. Because a lot of things are coming out now to show that certain things that people used to say intuitively, they don't even know how they knew this, but they were saying it. And sometimes some of these have been verified, you know, in authentic empirical ways. So yes, I think I've heard that before. And I can say of a fact, in my own family also, we didn't have okra. Okra wasn't part of our menu. I don't know why. But when I was in high school, we ate okra in school. So when I was in boarding school, so nothing happened to me while I was eating the okra. But all I know is this: yes, that there are mindsets or belief systems that have spiritual connotation to even ordinary food. And if you believe it, of course, you know, I mean, you have to practice what you believe. But for most people, like me, I eat okra. I like okra. And Brother Michael Ye, will tell you okra is super, is super food.
Well, I would say, just to answer your question directly, there is no scientific basis for this superstitious belief. Okra is an excellent vegetable. It's nutritious. It's Papa Mike, are you on, sir, to tell us?
He's on. That's why I call his name.
Yeah, I know he's on. I'm saying, sir, if you please unmute, sir, to let us know there are benefits to okra. There is no scientific, there's no medical scientific explanation or basis for it. It is superstition, as you call it. It's an excellent food source for good things. So since Dr. Veronica says okra is described as a superfood.
Mm-hmm.
So, sir, Dr. Ekale, sir, welcome, sir.
Yeah.
So, okra, sir, can you shed light to it for us, sir? Is it bad spiritually, supernaturally, medically, naturopathically, sir?
Okra is a very wonderful gift from God. First and foremost, it is anti-diabetic. If somebody wants to experiment it, let him or her slice okra fresh okra, put it into good water, allow it to stay for hours or overnight, and drink the resulting water, say three days, and measure the blood sugar. You will be surprised. So putting it in soup is very good for those who are diabetic. It reduces blood sugar. That is not all. Okra is good for fertility. And for men, okra is good for sexual strength. Look at the shape of the okra. Look at the shape. It looks like uncircumcised penis. And the seed inside symbolizes sperms. Now, in naturopathy, we call that signature.
Mhm.
There are things in nature that speak to us about what they do. I eat a lot of okra. I love it. Now, the mucilage in it fabricates the kidneys and will help to remove kidney stones. The same thing applies to the mucilage in water leaf. Water leaf. I don't know whether you know water leaf.
Yes. Mhm.
The mucilage is good for the kidneys, for the health of the kidneys. So that is that with okra. But I wanted to say something about at least daily preventing, blocked nose. Some teas can help. Just before going to bed, say an hour before going to bed, if somebody can take some of those teas, they will help to shrink the polyps and create airway for the person. Ginger is one, peppermint is one, garlic is another, chamomile is another, and so on and so forth. All right. Dr. Ajagbe, thank you very much for that comprehensive, presentation. God bless you.
Thank you, sir.
Amen. Thank you so much, sir. God bless you, sir. Wow.
Thank you. I eat a lot of okra. I actually grow it. I pick okra every day in the summer. And
Very
it's
good.
nice and
Very
fresh
good,
if you
doctor.
grow your own okra.
I'm coming to your house.
Well, you have to come
Fresh
soon
okra.
and get it. My tomatoes and okra are dying, but you should just grow it in the heat. It takes a lot of sun, and you could get okra all through the summer.
I'll be
You
there on
can
Friday.
eat, doctor.
I'll be
Doctor,
away.
Yes,
Yeah.
sir. Yes,
doctor,
sir.
you can eat the tender leaves. The tender
Okay.
leaves as a vegetable.
Okay.
Very rich in mineral. Yeah.
Oh,
Okay. I will.
The Yorubas call it ilasa. Ilasa.
that's new.
People, women who have just delivered, eat that for removing inflammation in the body.
Wow.
The leaves.
So
The tender leaves.
if it removes inflammation in the body, sir, would it remove the inflammation of arthritis?
Why not?
Oh, wow. Okay, because arthritis is inflammation. So,
Yeah, it is.
oh, wow. Sister Aduke, thank you so much for this question. I think she was the one who asked the question. Thank you. God bless you. Wow. Thank you so much, sir. We appreciate you as always, sir.
You're welcome.
Thank you, sir. So, Dr. Ajagbe, before I revert back to you to give us your closing encouragement, the time is here that I want to share. It's been asked on Medical Mondays that we need to get together physically, that we need to, meet and see each other. And we said, be patient, because NAPAC is going to be having its, annual general meeting, and we will, align with NAPAC and come together. So it's been set. The date is November 3rd and 4th. November, 2nd, if you're coming from out of state, you can come in. So if you go to napacusa.org, which is the screen I'm sharing with you right now, NAPAC, NAPACUSA.org. This is what you will see at the front page, the 2023 annual general meeting in Baltimore. So this way we can meet, the Medical Mondays family can meet in person. I want to meet everybody that I've not seen yet in person. If, we can, you can come. So if you're coming from out of state, you can arrive Thursday, Friday, it doesn't matter. But Friday, we're going to have a cruise in the evening at the Baltimore City Cruises. It's fun. People in Maryland who have been will tell you that it is fun. And on Saturday, we're going to have the gala. So it's really November 3rd and 4th, and you're going to learn a lot about NAPAC. So when you get on the website, you will see the event itinerary up front there. If you're coming from out of state, book your hotel. We were blessed to get hotel rooms. Can you believe it? For $86 a night in Maryland. They usually run like, the 100s, 200s, 400s, but we were able to get that. If you would like to sponsor us at NAPAC, we would appreciate it. We have sponsor packages here, and you can also advertise to just congratulate NAPAC, in our brochure for only $100, or you can, advertise your business also, whichever way you want. A full page is $100 there. If you have a business and you want to promote it, you can get a table for $500. But if you sponsor, guess what? Some of the sponsor package, you get that for free. Some you get it discounted. And then this is the cruise. If you want to do this cruise yourself, it's $126.13. We got it. We're not making jack from it. And you will get it for $99. To go on that cruise. It includes, a full staff, DJ on deck, come show me how you can dance. I can rock it, trust me. And I don't stop once I start dancing. And, he has full buffet and cash bar. It will be available. We also, if you want to buy, caps and t-shirts from NAPAC, you can do that. And the gala night, if you like to, again, sponsor, you can get a table of 10 for $1,000. If you do that, you're going to be getting half a page to, congratulate NAPAC or advertise your business or anything you want to advertise. And the gala ticket is $100. This is really, really affordable. I'm looking forward to everyone coming to hang out so that we can have a blast and learn about NAPAC also. Along the way. And you will be meeting some, amazing dignitaries that maybe in the near future I'll be sharing, but we have amazing dignitaries that you will be able to meet face to face. So if you have any questions, you can ask me by email, you can chat me, you can text me, but it's NAPAC, NAPACUSA.org. Thank you. So Dr. Ajagbe, over to you, sir. You are muted.
Well, thank you, ladies and gentlemen, for granting me audience to share a little bit of what could be easily confusing and complicated and complex in their interrelationships with you tonight. And thank you for also raising up some issues that address some of my own personal experience, not just with breathing, but also with food and allergies. And I think it's all about us growing up being wholesome in every way. And being wholesome means that we're able to eat, we're able to process the food, we're able to use oxygen that we're breathing in to burn the energy, to burn the calories that we have, to release energy for us to function, and the cycle goes on. And the cycle of life goes on. And all we're trying to do is to make sure that we remain healthy in every decision that we're making. Mental health is very important, as well as physical health, because anyone who is involved with ulcer that is untreated definitely will have problem with mental health. Not necessarily running raving mad on the street, but not being able to sleep properly and getting enough oxygen saturation for the brain and other body functions will make that person not to be optimal in their performance in life. So please pay attention to your body, particularly if you're unable to sleep well at night because your nostrils are constantly being blocked. I assure you, if you practice the breathing exercise I showed you, your nostrils will be opened. You'll be able to sleep at night. And when you sleep at night, you wake up refreshed in the morning. That is our goal. That is the goal that we are setting for everybody, so that every day will become very fruitful for us, not being so sickly or so sad because we didn't get enough rest at night. Thank you for the time. And I really enjoyed the interactions and the questions that were asked. Remain blessed, everyone. And thank you.
Thank you so much, Dr. Ajagbe. We are the one who are very, very grateful for imparting into us so powerfully. And thank you so much again, sir, Papa Mike Oye, for always opening our eyes to things in our surroundings that are beneficial to us and we don't even know. Can you imagine the leaf of okra tree also has benefits? And thank you, Medical Mondays family. You guys are awesome. Oh my gosh. Thank you. God bless you all.
Okay, good night.
Good night. And oh, by the way, next week,
Good night,
please don't
everyone.
miss next week. It's very
Night,
important.
everyone.
Good night.
Good night, Dr. O.